students, I am Dr. Zilema, and in today's session I am going to talk about hand hygiene. So points to be remembered about hand hygiene are: what is hand hygiene? What are the two different methods of hand hygiene? What is its significance? 5 moments for hand hygiene, and at the end the proper steps of hand hygiene. So what is hand hygiene? Hand hygiene is an act of cleaning hand for the purpose of removing dirt, soil and microorganisms. There are two different methods for hand hygiene. First is hand washing and second is hand sanitization. Hand washing with clean water and soap is effective in removing microorganisms, dirt, soil and kind of chemical from your hands. Second is hand sanitization, that is rubbing hand with 60% alcohol-based hand sanitizer. It is as effective as hand washing for removing microorganisms from your hands, but is not effective in the case where hands are soiled with dirt. So it is an acceptable alternative when hand wash is not available. So what is the significance of hand hygiene? As we all know that hands are the main pathways for transmitting the germs. So hand hygiene is an extremely important step in preventing the infection from person to person. Now there are 5 movements for hand hygiene. These movements define the key movements when healthcare provider should perform hand hygiene. First is before touching the patient. Second, before performing an aseptic procedure. Third, after touching the patient. Fourth is after touching the patient's surroundings. And fifth is after getting exposure to body fluids. So there are different steps for hand hygiene. First of all, steps of hand washing. Now we are going to discuss the steps of hand washing. There are 10 different steps of hand washing. Step 1 is wet hands with water and applies enough soap to cover all hand surfaces. Then step 2 is rub hands palm to palm. Step 3 is rub palm over the back of the other hand with fingers interlaced and vice versa. Step 4 is palm to palm with fingers interlaced. Step 5 is back of fingers to opposite palm with fingers interlocked. Step 6 is rotational rubbing of thumb clasped in palm. Step 7 is rotational rubbing forward and backward with clasped fingers of right hand in left palm and vice versa. Step 8 is rinse hand under running water. Step 9 is dry hand thoroughly with paper towel or air dryer. Step 10 is use your elbow or paper towel to run off the tap. Now the steps for hand sanitization. Now the steps for hand sanitization are how to sanitize your hands. There are 3 different steps for hand sanitization. Step 1 is apply sanitizer in the palm of your hand. Step 2 is rub your hands palm to palm. Step 3 is cover all surfaces of your hand until hands get dry. So now I am going to demonstrate the proper steps of hand hygiene, including hand washing and hand sanitization. So the things required for hand hygiene are running water, hand wash, hand sanitizer and the paper towel. So first of all I will perform the proper steps of hand washing. Step 1 is wet hands with water and apply enough soap to cover all hand surfaces. Then step 2 is rub hand palm to palm. Step 3 is right palm our left dorsum with fingers interlaced and vice versa. Step 4 is palm to palm with fingers interlaced. Step 5 is bend of fingers to opposite palm with fingers interlocked. Step 6 is rotational rubbing of thumb clasped in palm. Step 7 is rotational rubbing forward and backward with clasped fingers of right hand in left palm and vice versa. Step 8 is rinse hand under running water. And step 9 is use paper towel to dry hands first. Then step 10 is use paper towel on your elbow to turn off the tap. Now your hands are safe.